Hey guys, welcome back to another video. So guys, if you have not subscribe, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video you will be the first person to be notified. So guys, let's talk about something that is very important. What am I trying to say? A woman has 4 people in one body. What am I trying to say again? A woman presents 4 times differently in 28 days. What am I trying to say again? I'm trying to explain menstrual cycle. Now, what is menstrual cycle? Menstrual cycle is a process by which a woman's body prepares for the pregnancy. If the egg is not fertilized, then the uterus shed its lining and menstruation occur. Now we have 4 phases of menstrual cycle, and these 4 phases of menstrual cycle a woman will present in 4 different ways. So in these 4 phases we have the follicular phase, the first phase, the ovulation phase, and the luteal phase, and the last one is menstrual phase. So during these phases a woman will present differently. One day a woman will wake up and she's just very moody. She doesn't want to talk. She just get pissed off out of nothing, and you wonder what is happening. Remember, a woman present 4 times in a woman present differently in 4 ways. So let's start with the follicular phase. Follicular phase is the first phase, and it starts on the first day of your period and lasts for about 13 to 14 days. So during this phase, the lining of the uterus thicken, and it prepare the uterus for the pregnancy if in case the fertilization occur. Ovarian follicle grows, and also this phase there are a lot of hormones that are involved. We are going to look at them in this video. So the second phase is ovulation phase, where now the woman is the body wants to get pregnant. The body wants to get pregnant, and during this phase some women appear to be so happy. They're just so jovial. There is the release of a mature egg from an ovary. It usually occurs around the 14 days to 28 days, the 14 day, 14 of 28 days of the cycle, and it lasts for about 16 to 32 hours. That means it might be maybe 2 days, 1 to 2 days. We have the follicular phase, the luteal phase. The luteal phase start immediately after ovulation, last about 15 to 28 day of 28 cycle. The rupture of the follicular that release the egg become the corpus luteum, which produce progesterone hormone that help to maintain the pregnancy when the placenta has not taken. So you have to know that menstruation is the monthly shedding of the lining of the uterus, and menstruation is also known by the term menses, menstrual period, monthly period, menstrual cycle. So many names have been used. And menstrual blood is sometimes, not sometimes, it is usually partly blood and partly tissues from the inside of your uterus. So uterus flow from the blood, or the tissue plus the blood flow from the uterus to the cervix to the vagina. That is what you usually see as the blood coming out. It is not always pure blood. It is partly blood and partly tissues. Also, another thing that you have to know, that menstruation is divided or it is controlled. It is controlled by hormones. Hormones are chemical messengers in your body. your pituitary gland in your brain, and your ovaries, part of the reproductive system. So these hormones make and release certain this pituitary gland and the ovaries, they make and release certain hormones and at certain times during the menstrual cycle. So this hormone causes the lining of the uterus to thicken. This happens so that if pregnancy will occur, an egg can be implanted into the uterine wall. So hormone also cause your ovaries to release eggs, that is ovulation that we have talked about. The eggs move to the fallopian tube where it waits for the sperms to get there so that fertilization can occur. Also, the average length of menstrual cycle is 28 days, but that is the average length. But some people might get their menses on day 26, some day 32. So the longest menstrual cycle is 32 days and the shortest is 26 days. Yeah, so between 26 and 32 days you can get your cycle. So the days between period in your menstrual length differ from different people. That is why you usually get that when you menstruate this month on 2nd, maybe next month you might menstruate on 4th or maybe on 30th. Also, you have to know that people start menstruation at different ages. The average age is 12. Some can start their menses at the age of 16, 17. However, you can begin menstruation as early as 8 years old, and at least the latest 16 years old. So past 16, you must go and get checked by your doctor. People stop menstruating when they are approaching menopause. So most likely it happened at an average age of 51. Latest 55 is when you will stop menstruating completely and you start your menopause. Yeah. So what are the signs of getting your period? What are the signs of getting your period? Some people experience symptoms of menstruation and others don't. Like me, I usually experience some symptoms. I know somebody somewhere doesn't experience any symptom, so they usually just get their menses without knowing. So signs and symptoms that somebody might experience are mood changes, trouble with sleeping. You can get headache that you don't know where they are coming from. You can get food craving. You're just craving for a certain food, or you just want to eat a certain food. Bloating, which is so common. Breast tenderness, and I think this one, most of the people usually experience it. That is acne. Most of the ladies usually experience acne. You also have to know that menstrual cycle can change from teens to 40s to 50s. So when you start your period, it is normal to have a longer cycle or heavier period flow, and it can take up to 3 years for a young person to get their regular cycle. So when also you start your period, you might also get mostly cramps. Yeah, you might also get cramps. Sometimes these cramps goes away as you continue with your period. Sometimes they continue up to even when you give birth is when they will disappear. Sometimes some people even experience cramps after giving birth. So what do you consider as irregular period? Irregular menstruation describes anything that is... So what do you consider as irregular menstruation? Irregular menstruation describes anything that is not normal during menstrual period. Some of Examples of irregular period are period that is less than 21 days or more than 35 days, not having a period for 90 days, that is 3 months, menstrual flow that flow heavy, also menstrual that lasts more than 7 days, menstrual period that lasts more than 7 days, bleeding or spotting in between periods. So we have so many irregular periods or abnormalities during menstruation, so we will talk about them in different video. So let's stop from there. Let's meet in the next video. Bye till next time.